Dr. Ira Krafchin, a board-certified plastic surgeon, practicing both in Clark Summit and Wilkes-Barre, Pennsylvania. I specialize in both reconstructive and cosmetic surgical procedures. I think the patient, when they come in, needs to know what they're unhappy with. I don't impose my values on what their nose should look like because it may not be what they want. So if a patient comes in and says, I don't like my nose, I really can't help them. If they come in and say, I don't like the bump, I don't like the shape of the tip, then we can sit and have a discussion and I can tell them what we can achieve for them. It is helpful. They give you an idea stating that I want the bump removed from the top of my nose, I want the tip adjusted. We can help them with that. If they come in with a picture of somebody in a magazine and say, I want a nose like that, I feel that I really can't help them because their facial structure, their nasal structure, the thickness of their skin, and a whole bunch of other details may not allow that to happen. You will see results when we take the splint off at a week's period of time, but it is not the final result. There's a lot of swelling and scarring and reshaping that needs to go on, and it can take upwards of a year to see the ultimate final result of the nasal surgery. The surgery will be done in an operating room. It can be done in an operating room in a hospital or an ambulatory center. The anesthesia varies slightly depending on the physician and surgeon and depending on the patient. It can be done under complete general anesthesia or it can be done under local sedation, again depending on what the surgeon and the patient agree on. Post-op recovery consists of wearing a splint and having packing intranasally for 1 or 2 days to a week. Then the natural healing process occurs, but the patient must maintain low activity level. There is no heavy exercise, certainly no contact sports, shouldn't be out in the sun. One does not want to get the skin of recently operated nasal surgery sunburned. That just can cause a lot of damage. The nose must be structured so it fits the patient's face. People have round faces, they have triangular faces, they have narrow faces. Skin is different from one patient to another. It could be thick, it could be thin. So each patient has an individualized nose that should be in harmony with the other features that they have.